Bariatric surgery is an intervention for grossly obese people. What happens to the microbiota after surgery, if the surgery is successful and the weight is down for long term? You have studies until 9 years after bariatric surgery. Do they have a healthy microbiota, or what do they have?
I wouldn't say at this point that they have a healthy microbiota, but they have a different microbiota. And so as far as we can tell, this microbiota may contribute to the improved metabolism of the patient after surgery. And what's quite astounding is that we see these changes in the microbiome really rapidly after just a few weeks of surgery, but some of these are also there 9 years after the surgery.
But is the microbiota then similar to lean people?
No, it's not.
No.
It's if you have obese and lean, quite similar, slightly different. The surgery microbiota is quite different from both of these.
Another target group is very interesting for long-term outcome. Those are the infants. Can you predict somehow from the microbiota of the infant the later obesity risk, let's say during pre-adolescent stage or during adolescence?
I think it's too early to do today. We and others have started collection of samples to address these questions in a prospective manner with very sophisticated methods that are now available that we didn't have just a few years ago. And there are a lot of support for the hypothesis that what happens early in life may have consequences later in life, such as early antibiotic usage or the way you have been delivered may confer a certain risk for...
let me ask you, antibiotic use during the first 2 years, is there enough evidence to indicate that there's a higher risk of obesity later?
I think so. With this, there's a very large study published just a few weeks ago with over 60,000 individuals, where they show that if you have broad-spectrum antibiotics, and especially several episodes, so you have a pretty profound impairment of the microbiota, then you have a higher risk for obesity later in life, in adolescence. And this is also supported with animal experiments. And I know that Martin Blaser likes to discuss this, that we have such an overconsumption of antibiotics in society today. So one way of looking at it is that could this contribute to the epidemic in obesity?
So we have to be careful in prescribing antibiotics. We cannot avoid them, but under many circumstances it's better to have a certain visit to a house of family where a child is sick and can avoid antibiotics. This is probably important for long-term health. Both
for long-term health, but also for the emergence of antibiotic resistance in society. Yeah. Okay. So I think we really need to be careful on how we prescribe antibiotics. Everybody who has children knows that it's easy to say that society should not use antibiotics, but then if your child has an infection, you're the first to use antibiotics.
Okay.
So I think we have to have a really educational program for society so they understand, and we as well, the risks of having antibiotics early in life.
Okay, thank you very much.
Thank you.